Hello, my name is Stella Rockwood and this is my Pediatric Assessment CPE. I'm just going to point the camera down so that you can see my pillow patient. Okay. So I would start off with WIPA. I would wash my hands when I walked in the room. I would introduce myself. I would identify my patient, and then I would also identify the relatives as well. And then I would provide privacy, pull the curtain, and I would explain to the patient that I am going to be checking him out, making sure everything's all normal and good. And I would explain to the relatives as well what I will be doing, that I will be doing a full head to toe assessment, checking them over on admission. And then I would ask the patient and the relatives if they have any allergies and what they might be. And then I would just start with my assessment, going over some neurological things such as I would ask the patient where we are. They could answer just the hospital. They don't have to know the exact name of the hospital, just to know where they're at. And then I would just start at the head. I would look over the scalp, making sure the hair is evenly distributed, there's no lesions, everything's well kempt. And then I would just, while I have my patient sitting here, I would be looking at the whole body, making sure they're growing and developing symmetrically. I would look at the skin to make sure that it's dry and intact, there's no lesions. And I would also ask my patient if they like what their bathing and showering schedule is like, to make sure that they're keeping up with their hygiene. I would then go back to the head. I would be looking at the eyes. I would check for perla. I would use my pen light and I would ask the patient to sit up. I would shine the light in the eyes, bringing it in, and then I would have the patient look at the light or look at the pen, and then ask them to look over my shoulder, and I would do this to both eyes. And then I would ask them to look at the pen as I bring it in. Okay, perla is present, it's great. And then I would check the conjunctiva. We want the conjunctiva to be pink and the sclera to be white. And then I would move on to the lips. The lips are moist and pink. And then at this time, I would ask the patient to open their mouth and say, ah, really big. And they would open it up. The oral mucosa is pink and moist. And I would ask them also at this time if they have lost any teeth yet, and ask mom as well. And then I could move on to the ears. I would pull the pinna up and back to look into the ears if the child is over 3 years old, and I want to be looking for any drainage or any abnormalities. And then I would move on. I could start moving down to the carotid pulses. You check these one at a time, and they are regular plus 2 bilaterally.